In 1874, Sir James Paget described Paget's disease of the breast. Now, what is Paget's disease of the breast? Why is it such a rare form of breast cancer? How would I, as a patient, potentially recognize Paget's? Is Paget's often misdiagnosed for eczema, as an example of the nipple or areolar area? Well, I'm going to try and keep the definitions non-medical here and pretty straightforward and pretty simple if I can. Paget's disease of the breast makes up only about 1 to a little over 4% of all breast cancers. When you look at the nipple or the nipple and the areola, to the eye, it does look like eczema. And what's happening is the cancer cells are coming up and getting into and growing into the surface, the epithelium, if you will, covering the nipple, giving that kind of scaling effect, that kind of heartbreak, if you will, of eczema. Quite frankly, through the years, I've lost track of the number of patients I've seen with Paget's disease of the breast whose primary care physicians initially treated them with topical steroids, thinking that this was eczema of the breast. Could it be? Yeah, it's part of the differential. But far more important, if you have changes like that of either the nipple and or the areola, the very first thing that needs to be done is your breast needs to be seen and evaluated by a breast surgeon. You need imaging studies, including mammograms and ultrasound, and possibly even MRI. Making the diagnosis is pretty simple. You can do a little punch biopsy like dermatologists do of the skin of the nipple, and there's certain pagetoid cells that make it straightforward for the pathologist to make the diagnosis. Now, typically there's an underlying cancer underneath the nipple areolar complex. It can be downstream, if you will, and the cancer has come up the ductal system into the nipple. And so we often see Paget's associated with either in situ breast cancer or invasive breast cancer. There are times, but not a lot, where we can't actually find the source underneath the nipple areolar complex, and particularly now with breast MRI, we should almost always be able to find the source. Well, what about the treatment? The treatment of Paget's is basically like an in situ cancer if that's what it's associated with down deeper in the breast. Unfortunately, the nipple and areola typically need to be removed, as well as obviously treating the underlying cancer. So there are lots of variations to Paget's disease of the breast. I don't want to try and get into all those variations now. Paget's is an unusual form of breast cancer. It is treated in a very straightforward way by multidisciplinary centers. You need the appropriate imaging studies to figure out what's going on underneath the nipple area. And the bottom line for our viewers is that if you or you know someone that has what you believe looks like eczema of either the nipple or areolar area, you need an evaluation right away. Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
about personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.